B. Brown is pleased to introduce the IntrocanSafety 3 closed IV catheter. Let's see how a proper insertion is accomplished. Prior to insertion, prepare equipment and patient for the prescribed therapy and confirm patient's identification. Explain the prescribed therapy and why IV access is necessary. Follow your institution's policy for proper hand hygiene. Don gloves, confirm all equipment is prepared and accessible during the procedure, including a sharps container. To promote vascular distension, apply a tourniquet above the selected insertion site. The vasculature selected should accommodate the gauge and length of the catheter required for the prescribed therapy. When choosing an insertion site, consider the location and condition of the vessel, the solution to be administered, and the duration of the IV therapy. Prepare intended insertion site with an antiseptic solution, including the area where the dressing will be applied. Allow to air dry completely. Open the package by grasping the corner of the lid and peel back completely. Remove the IntrocanSafety 3 from packaging with protective guard in place. Flex the stabilization platform by lowering and raising the platform and return to a horizontal position. Holding the protective guard and flashback chamber as shown, remove guard in a straight, outward motion. Confirm catheter hub is properly seated on the flashback chamber. The IntrocanSafety 3 closed IV catheter is designed to accommodate a variety of insertion techniques. Choose the grip that is most comfortable to you and allows clear visibility of blood return in the flashback chamber. Without touching the cleansed area, stabilize the vein with a gentle skin traction to prevent rolling. Hold the IntrocanSafety 3 at an appropriate angle over the vessel. With a smooth, steady motion, insert the needle through the skin and into the vessel. Upon insertion, the first flashback of blood, needle flash, is visible in the clear flashback chamber, confirming the needle tip is in the vessel. Lower and advance the entire needle and catheter unit slightly to ensure the catheter tip is in the vessel. Hold the needle and flashback chamber assembly stationary. Use the push-off plate to slightly advance catheter off the needle. A second flashback, catheter flash, is seen between the needle and catheter, confirming the catheter is successfully in the vessel. Upon confirmation, continue advancing the catheter completely into the vessel. Release the tourniquet. Before removing the needle, gently press the stabilization platform to the skin to stabilize the catheter. The needle is withdrawn straight out of the hub in a controlled and continuous motion. The passive safety shield protects against needle stick injuries by automatically engaging the needle tip as it passes through the catheter hub. Discard shielded needle into a sharps container. The multi-access septum closes, controlling the flow of blood from the catheter hub and works multiple times to help prevent contact with the patient's blood throughout the entire procedure. The ergonomic hub design allows for easy connection of accessory devices. Apply a sterile transparent dressing with notch placed in front of push-off plate. Wrap ends of notch beneath catheter hub and apply firm pressure. Label IV site per institution's policies and procedures. The second option is to apply over the dressing. Apply tape strip over catheter hub. Loop the IV tubing and secure with an additional piece of clean tape. Attach Luer slip or Luer lock, flush syringe and flush according to institutional protocol. Start infusion. Select and prepare site. Open package and remove the IntrocanSafety 3 closed IV catheter. Flex stabilization platform and return to horizontal position. Remove protective guard in a straight, outward motion. Confirm catheter hub is properly seated on flashback chamber. Anchor vessel with gentle skin traction. Adjust angle of insertion and access vessel. Observe blood return in flashback chamber to confirm vessel entry. Lower and advance the entire catheter and needle unit slightly to ensure catheter tip is in the vessel. Hold needle stationary. Slightly advance catheter off the needle and observe blood return between the needle and catheter to confirm catheter is in the vessel. After confirmation, continue advancing catheter off needle and into vessel. Release tourniquet, stabilize catheter and withdraw needle. Discard shielded needle in a sharps container. If applicable, perform blood sampling procedure. Stabilize catheter and apply a sterile dressing. Flush and attach an administration set.